You may have learned how to do some sort of relaxation breathing at some point in your life, and you probably felt like it really didn't help. Well, I'm about to teach you a different type of breathing I call 3x3 relaxation breathing. Begins with putting one hand on your stomach and one hand on your chest and taking a very slow, deep breath through your nose. Now, when you inhale, does your stomach rise or does your chest rise? Relaxation breathing is most conducive when your abdomen rises as you inhale. If your chest rises, you are a chest breather and you are not doing relaxation breathing. Push your stomach out using your stomach muscles. Don't breathe, just push your stomach out and see if you can do it. Push it out hard, let it fall back. Now try to push it out slowly. Again, don't breathe, just push it out slowly and then bring it in slowly. If you're having trouble, you're going to have to start developing those stomach muscles by doing stomach push-ups, pushing your stomach out, letting it fall back. Doing it every single day until you can push it out slowly and then bring it in slowly. Now, the first step in 3x3 relaxation breathing is inhaling slowly through your nose, pushing your stomach out slowly and pausing for 3. And then exhaling through your nose, and you just did your first breath. So let's try that. Inhale slowly, pushing your stomach out, pause for 3, and now exhale slowly. Good. You just did the first step. The next part in 3x3 relaxation breathing is what you say to yourself as you are breathing. You're going to inhale slowly through your nose, your stomach is going to rise, and you're going to pause for 3, and then you're going to exhale slowly. But while you are doing that, you're going to think a phrase. And the phrase that we're going to start with is, I can relax. As you inhale slowly, you are going to think the first half of the phrase slowly. I can, and then you'll pause for 3 and then exhale. Relax. And that's it. You can use any phrase you want, but we'll use the phrase, I can relax. The reason why I like patients to think a phrase slowly is because when people are anxious, everything seems to be going fast. Pulse, blood pressure, breathing, thinking. We need to slow everything down, including our thoughts. So I can, as you breathe in, pause for 3, relax as you exhale. Oftentimes therapists will teach some sort of relaxation breathing and they'll tell their patients, when you feel anxious, breathe. But it tends not to work. And one of the reasons it does not work is because the person has not been practicing it. The idea is that you practice it when you are not stressed so that when you are, you know exactly what to do. When you practice, you're going to be doing 2 sets of 3 for a grand total of 6 breaths, which is essentially 1 minute of practice. Inhaling and exhaling 6 times, 1 minute of practice, 5 to 10 times a day, periodically throughout the day. Once in the morning, once at bedtime, and then several different times throughout the day. Stop what you're doing, breathe, and then continue on with your day. Sometimes breathe with your eyes open, and sometimes practice with your eyes closed. Because there will be circumstances where you will not be able to close your eyes. For instance, when you're driving, when you're at a meal with some people, when you're in a class or an office setting, you won't be able to close your eyes. The beauty of 3x3 relaxation breathing is that you can do it anywhere because no one will notice. It's very subtle. It's silent. When you're inhaling and exhaling, the breath is silent. There is no noise. So it doesn't sound like this. It sounds like this. It's silent. So you won't remember to practice. It's not in your daily repertoire of things to do. You're going to have to write little notes to put around. You're going to have to set your cell phone to go off periodically throughout the day. And then each time it goes off, stop for 1 minute and breathe. So that's 3x3 relaxation breathing. Practice it every day. And when you feel anxious, that is when you're going to put it into practice. Remember, practicing 3x3 breathing is only 6 breaths, but when you're using it to calm yourself down, you're not counting. It could be 20 breaths. It doesn't matter. You're just breathing long enough to contain the anxiety. Also remember, when you're feeling anxious, you're going to want to start using 3x3 breathing as soon as anxiety starts. Don't wait for your anxiety to reach like a level 8. Start when it's at a 3. It's easier to put out when your anxiety is small. It's going to take a while for anxiety to come down the higher it is. And last thing I want to mention, and this is super important, 3x3 breathing is not a panacea. It will not take away your anxiety in all situations. It's not meant to. It's to help you get through anxious moments, anxious situations. Think of it like an umbrella in the rain. The umbrella is not there to stop the rain, it's to help you get through it. That's what 3x3 breathing is. And if it doesn't reduce your anxiety, you have lots of other tools to use. But if it can reduce your anxiety a little bit, that's fantastic. So that's 3x3 breathing. It will get easier the more you practice it. So don't give up on it, practice it, and then implement it over the course of the next weeks and months and throughout your entire treatment.